CURES is sponsored by Wheeler Health's Better Choice program. More at wheelerhealth.org.
Helping you lead a healthier life. This is CURES.
Hi, everyone. Welcome to the CURES Show, where we explore the cutting edge of wellness from credible sources. I'm Kara Sundlin. And ADHD, it's often seen as a disorder of childhood. Many of you watching may have gone through this with your children. But in recent years, an increasing number of adults have also been diagnosed. So joining us now to talk more about this is Dr. Laura Saunders. She's a psychologist at the Institute of Living, a premier mental health facility right in Hartford, Connecticut. Thank you so much, doctor, for being here.
Thank you for having me, Kara.
So why is it that more adults are being diagnosed? Is there something wrong? We're getting it more, or it's just we're seeing it more and we know what to look for?
So, for many years, attention deficit hyperactivity disorder, or ADHD, was really seen as a disorder of childhood. And, with the advent of all these online quizzes, a decrease in stigma, improved access to care based on telehealth rules, and some other factors, more and more adults are being diagnosed with ADHD too. As you brought up in Great Day, what sometimes happens is the child or adolescent is diagnosed with ADHD, and then you realize that one of the parents, in fact, had some of those same signs and symptoms when they were a child, and are diagnosed themselves.
So how does it affect us differently as adults?
So it really is a continuum disorder. And the other thing that I like to note is that even for it to be diagnosed, for ADHD to be diagnosed in adults, you still need to be able to trace back the symptoms to before age 12. So it's not like, you're 25 years old, you're 35 years old, and you realize you're highly distractible and kind of impulsive and motorically restless. And then, that just happened 6 months ago. That actually would be anxiety, right? So, we can talk a little bit about rule outs, but it has to be traced back to before age 12. And what we see in the three core symptoms, so the three core symptoms in ADHD are inattention, impulsivity, and hyperactivity. And, we can talk a little bit about some of the gender differences because there's higher rates of ADD, so without the hyperactivity component, diagnosed in females. But if you take those three core symptoms, inattention, impulsivity, and hyperactivity, and you add a developmental spectrum to them, you can really see how some of those core deficits shift and change.
Yeah, the statistics are interesting. 15 million adults say they have ADHD. Half of those diagnosed as adults. I listen to the Mel Robbins podcast. She's very well known. She was diagnosed. She thought she was suffering more from anxiety or other things and was diagnosed at age 48. And then all of a sudden, a lot of things made sense. So some might be saying, well, why do I even need a diagnosis as an adult? How does it help, and what are people finding out?
Well, I always think that identifying what's going on and in some cases providing a diagnosis can be immensely helpful to have you better understand yourself. When you better understand yourself and understand what your core deficits are or your strengths are, it helps you take steps forward and not feel so different or crazy or any of those things that just make you feel bad about yourself, that create a lot of shame. So identifying what's going on, looking at your core strengths and areas of deficit, and then, no matter what age you are, creating an action plan to accentuate your strengths and, kind of minimize your deficits is always more beneficial to the quality of life.
Okay. So, I think as moms especially, let's talk a little bit about how it differs in women versus men. Today, at the day of this taping, it is National Working Moms Day. One of the core symptoms of ADHD is disorganization. And what I understand from reading at this is sometimes women get through their whole life. They might feel like they're losing things or struggling to keep it all together. And then the act of parenting and managing a house and all that, they get to a point where they can't do it anymore. So there's a difference in the ADHD brain when it comes to organizing, executive function.
Yes. So, and that's the point that I'd wanted to make. So in females, there are actually higher rates of ADD, so without the hyperactivity. That is most often diagnosed actually in middle school into high school. Because if you think about it from a developmental spectrum, middle school and high school is where you have multiple classes and multiple notebooks and multiple assignments. Things get really divided up, much longer term assignments, not just like you get the homework today is due tomorrow. It's much longer term projects. And so that is where you often see the level of disorganization that is so critical to be a good student.
Yeah.
You take that core issue, that disorganization, and you put it on top of a very full life, right? So what was your comment earlier, your quote earlier? A working mom, works about 98 hours a week, right? That's about 2.5 jobs. So you add in all of these different roles and responsibilities, and with a brain that's just wired a little differently, a little neuroatypical, and with disorganization on top, and it becomes exhausting and overwhelming to manage.
Yeah. And so, what do you do about it? As an adult, do you take stimulants? Is that the general thought? Or are there other things we should be doing if you're feeling this could be you?
So once you do that kind of initial diagnosis, right? So it's not anxiety, right? It is in fact kind of a core deficit in the areas of attention, impulsivity and or activity, hyperactivity. And medication can be helpful, right? So that's why you really need an accurate diagnosis, because if your diagnosis is anxiety, you might actually take an antidepressant. If your diagnosis is ADHD, you might look at a stimulant, because the stimulant does help your focus and your concentration. And if you think about it from an adult standpoint, organization really is a critical skill to have, no matter what your job is. If you're a working mom, if you're a working dad, no matter what your job is, organization really is critical to functioning as an adult with multiple responsibilities.
Also, so in adults, hyperactivity might decrease. Maybe we can sit still a little longer, but inattentiveness actually could increase?
Yes. And so if you think about, an adult, yes, that hyperactivity, that because the demands are different. So a hyperactive teenage boy who's sitting in a classroom, tapping his pencil or poking the person next to him or throwing something across the room or talking or doing all those things, it is very evident, right? You take that adult and you get them through college or skills training or a trade, and then they're hopefully working in an area where they can not be sitting at a desk job, because that would really make them feel like a caged animal. But these often are the individuals that are really great in a lot of the trades. These are, not always, but your plumbers, your electrician, your HVAC, your metal worker, these are very active jobs where you need to be moving and doing. Still very bright individuals. If I have a plumber or electrician working on my house, I want them to be pretty bright. And they are pretty bright. There's nothing saying that someone with ADHD deficits is not as bright, but it requires extra work to organize your brain, help yourself focus and paying attention, and move forward in managing some of the other deficits.
Yeah, I want to just shout out there's a resource that I'm sure you're aware of, but when I went through this with my son who was diagnosed, the pediatrician at CCMC, a developmental pediatrician, recommended you start reading Attitude Magazine, ADD, Attitude Magazine. And there's more and more, as I've read this over the years, realize there's a lot out there about adults and the difference between men and women. And specifically, as we get to be adults and you think, well, why do I need this diagnosis now? It really, you say, could affect, if you're not handling this well, personal relationships or your professional life. Let's start with personal relationships. How can ADHD hurt a relationship?
Well, let's think about those core deficits, right? So inattention, right? If you're in a relationship and your partner is talking or asking you to do something and you're not paying attention because something else is flying into your head, that can be very distracting. If you think about the impulsivity, so you talk over your partner, you engage in risky behavior, risk-taking behavior. You have trouble with fidelity, if that's an important component of a relationship. So there's a lot of facets to ADHD that could be very difficult to manage for adults in relationships. So it wouldn't be uncommon that you'd see them in kind of in serial relationships, in and out of relationships pretty quickly, because they have difficulty managing some of the core aspects of kind of a committed and longer term relationship.
Okay. Now, other just lifestyle problems, you might have sleep problems. A lot of times with ADHD brains, it might be harder to settle down. There's concern about substance abuse. I want you to weigh in on those two things, and specifically the idea that maybe if you take medication, you're going to be more likely for substance abuse, because the research doesn't show that, right?
Right. So I've worked with many, dozens and dozens, probably hundreds of families at this point, in who have a young person with some of the real serious core deficits in ADHD. And it wouldn't be uncommon in those situations that a recommendation for a stimulant medication. Stimulant medication is the really most researched and most used medication in the field of mental health. And I've heard many parents say to me, I don't want to start my child on medication because it's just going to teach them that, that it's okay to take drugs. And I'd say, hold on, let me just tell you what the research shows. What the research shows is that, in fact, in those individuals who have serious core deficits in the areas inattention, impulsivity, and hyperactivity, if they can slow themselves down, develop better frustration tolerance, and better attention and concentration, it in fact decreases their likelihood in adolescence of developing substance use and substance abuse issues. Because that hyper teen or young adult, because you don't generally start drinking at 45, that hyper teen or young adult is using substances to slow themselves down, right? And that's what alcohol or marijuana would do for someone, is it would slow their thinking down, slow their body down. So when they learn frustration tolerance and when they learn the ability to focus a little bit better, they are in fact less likely to turn to illicit substances when they get older.
So interesting. And I know that's a whole nother show, and we've done it before, on cannabis and people using it, saying it helps their ADHD. You're not disagreeing that they may feel like it helps, but especially for a young person, it may not be it's not the right thing because their brain's developing. I don't know what your thoughts are on adults who say that it's helping them, and now we know it is legal in some amounts.
Yeah, so I have a lot of mixed feelings on marijuana use, in the same way that I don't recommend anyone have 2 or 3 drinks a night as a way to manage their frustration and anxiety. I also don't encourage nor think it's helpful or healthy to smoke weed, take edibles, whatever form you want to ingest it every night as a way to manage, anxiety and attention. In fact, there is some data to show that regular marijuana use actually you can get rebound anxiety on the back end. And so, I don't really want someone using those substances regularly. Now, am I saying that other medications don't have some side effects? Yeah, they do. But what we want to look at is, does the side effect profile help or support what the goal is in terms of taking the medication, or does it cause rebound problems that then also have to be addressed?
Okay. So the other way that it might manifest for people is a difficulty in managing time. And that can lead to procrastination. That might cause problems at work, or maybe your partner gets mad at you because you're always late or forgetting to show up on time.
Yeah, I mean, the time management is really tied into organizational skills. The ability to never run on time or be losing track of time or losing things is really critical. It's really critical if you have a job where you need to clock in and clock out and be on time. Again, that can be really disruptive in a relationship if you're, forgetting to pay bills or forgetting to do things, always running late. it's your turn to pick up the kids for carpool and you're running late in the morning or you're running late to pick them up at the end of the day. You could see how like some of these core deficits really could be a huge barrier and difficulty in family life.
Well, and so that people can feel empowered. ADHD, there's a lot of books out there saying ADHD. In fact, there's a book right now called ADHD is Mostly Awesome, written by oh gosh, the couple that does all the YouTube videos on their family and whatever. And he got a late diagnosis, I believe. But what do you think about the idea that some of the people will say that they couldn't have created, the founder of JetBlue says he couldn't have done it with ADHD, or the idea that Albert Einstein had ADHD. I think Elon Musk says that he also, all these really successful by any standard, even known for their work, have this kind of neurodivergence where maybe the impulsivity or the out-of-the-box thinking or the creativity help them. So what's your advice to adults who want to turn their ADHD maybe more into a superpower, and what they should do?
So it really is, again, it starts with the identification, and then it turns into maximizing your strengths and minimizing your deficits. As I said, if you're someone who's got tons of energy and still even as an adult has that hyperactivity component, that individual's not going to do well at a desk job, right? They might do well in a really active field like, some of the trades that we talked about. It's if you have difficulty in concentration and attention, and you're in a job where attention to detail and doing things in a very small and methodical way, that's going to be really hard for you, and you're going to feel a lot of kind of lack of success, or you're losing jobs. So it really is, when you can truly understand what your core strengths and core deficits are, it helps you maximize directions in your life. And that includes work and career, it includes relationships, it includes friendships, it includes parenting, right? Because, there's lots and lots of folks that have ADHD in their parents, and they can then recognize some of those same signs and symptoms in their children.
Yeah. And I know it manifests differently for lots of folks, men, women, or just even, different ways. There's not one kind of ADHD. Do you think adults should, first of all, let's back up and say, if you are an adult and you think you have ADHD, how do you even go about getting a diagnosis?
Well, I mean, for better or for worse, there are lots and lots of those online quizzes. And I've actually had people approach me and say, people I might have been working with, you know what, I took one of those quizzes and I think I qualified for ADHD. I said, hold on, what was the veracity of the quiz that you took? I think you can start with your primary care doc. You can, there are, centers that specialize in attention deficit hyperactivity disorder across the developmental spectrum. You can reach out. I do think it is important to get an accurate diagnosis, because as I said, you can have a lot of disorganization and impulsivity at 40, but unless you can trace the symptoms back to before age 12, it might be something else. It might be just a really overwhelming anxiety that you're experiencing or something else. So you do want to get an accurate diagnosis, because once you get the accurate diagnosis, then your treatment options may open up for you.
Okay. So would you recommend getting it? I mean, used to people be like, oh, I'm a little ADHD, or, oh, people joke about it, but you really are or you aren't, because there are, from the science I've read, there are differences in your brain.
Yeah, there are definitely differences, but it can be seen as a spectrum, right? There are lots of people who have difficulties within attention or organization that might be sort of on the lower end of that spectrum and have found ways to compensate and manage, right? So, I have a brother who was, his picture was next to ADHD as a child. And he, he's had his difficulties, but he's also found ways to maximize, his strengths and minimize his deficits. And so the more you can identify what's going on, kind of put a plan together, and then if you're being hindered in your life, and that's often the guideline that I want people to use, am I functioning at my potential? Am I functioning in a way that feels meaningful to me? Because if I'm not, if I'm, failing at relationships or losing jobs, or, having difficulties in finances because I keep spending money, I'm overspending money. If you're hindered in some way in your life, then it's time to take some steps to make some changes.
Okay. We're going to talk more about this and what you should do if you think you might have ADHD as an adult in a moment. But first, I want to take a quick break and hear from one of our sponsors.
Struggling with gambling? Wheeler Health's Better Choice program offers personalized support and treatment to help you regain control. Visit WheelerHealth.org to learn more and take the first step towards recovery today.
All right, we're back here at CURES talking about ADHD for adults. In fact, it maybe used to be thought of, it was many, many years ago, that it was just a childhood disorder. We now know that that's not accurate. It's something that can last throughout your life. But the question's more about what are you going to do about it? I'm joined by Dr. Laura Saunders. Do you have adults come see you? And is the advice different for them about strategies and things they need to learn?
Yeah, I mean, I definitely have adults come and say, I think I've been struggling this with all my life, but I'm just really recognizing it because, as we've said, now my child's been diagnosed. And in those situations, you really take a deeper dive and you look at how is this affecting your ability to function in your life, right? Are you okay with the work that you're doing or the career that you've chosen? Are you, stable in the relationships in your life? If you're being hindered, I mean, there are options. There's certainly, medication evaluation. There are strategies. If people need to make like some serious vocational changes and sort of shift sets in what they're doing for their livelihood. And it really is looking at how organization plays a role in your life. It's pretty common that individuals with ADHD consider themselves neuroatypical, meaning they're just different in some way in terms of how their brain's wired. Because the funny thing about a stimulant is you think, well, my goodness gracious, this person's hyperactive and with a lot of, kind of racing or impulsive thoughts. Why in God's name would we give them a stimulant? Well, in fact, the stimulant works in reverse because there's some thinking that it's because you actually have an underactive brain. So the stimulant serves to sort of level things out and help you focus and be more attentive.
Yeah, I mean, this lack of dopamine, I guess, is what people are learning about. And so that is one thing that I think, I know I experience from interviewing doctors and even in my own life, that sometimes when they do a medication trial, the medication should help the ADHD person calm down, where if you don't have it, it might make you feel very revved. And that might be one way of knowing, like, oh, actually, this isn't the right diagnosis.
Right. And actually, the stimulant medications, the class of medications for ADHD, it's something where it's like taking Tylenol, right? You'll know pretty quickly if it's helpful for you.
Yeah.
If you have a headache, you take a Tylenol, within a half hour, it should be gone. If you are taking a stimulant, you will know within 30 minutes, max probably about an hour, if it's helping you focus and pay more attention and pay better attention. So it's not something you have to try out for a month or so to see if it works. You can tell pretty quickly whether or not it will be helpful for you.
Yeah. And let's talk about lifestyle things. I know there's a pretty famous psychiatrist that people might see online, Dr. Daniel Amen, who's always putting out internet information on ADHD. He has a whole bunch of centers. But often I can see on his content, he'll say the best thing for someone who has ADHD is a job they love, which might be the case for a lot of people. But with you of ADHD, you tend to do really well if you're interested, but it's much harder if you're not interested in things, right?
Yeah, I mean, I would agree with you. That's probably true for a lot of us, right? If you're in a job that you're just barely tolerating, it makes most days miserable. But I think, the undertone behind that comment is finding something that matches your skills and your strengths, right? If you are that hyperactive person that really with that motoric restlessness, sitting at a desk job doing something all day is going to be mind numbing for you. It's going to make you feel like you need to crawl out of your skin.
Yeah.
So doing something that fits with your strengths and your deficits really is critical. I frequently apply this, what 100 years ago were there folks with ADHD, right? And 100 years ago, there definitely were. These were the individuals 100 years ago that, dropped out of school early and went to work in the fields or went to work in the factories or did the things that were very physically active, joined the military. They did things that were much more physically active because that matched better with, the attention and concentration it took to get through school did not always match well with a lot of folks with significant or severe ADHD. So these individuals have always been around. It's just matching your strengths with the work that you're doing, and hopefully that you really care about or love what you're doing.
Yeah. So modern life, sure, sitting and having to be at a computer a lot or all of that is going to be not the best. So in our final 3 minutes together, I want to talk about if someone's listening to this and going, what do I do next? I'm an adult. I probably have ADHD. What do they do?
Well, they do that, they talk to the people that they love around them and say, like, do you feel like this is really hindering me? Now that I feel more certain about a diagnosis, do you think I should, check out a trial on medication to really, I think it's really great to talk with the people around you that know you well and can say, yes, you know what, I think you need to take some steps. You're hugely underperforming in many areas of your life, or you've been struggling for years and you haven't figured out what was wrong or what will work best for you. So the more you can take steps, and if that means a medication trial, if it means therapy, there are cognitive behavioral therapies that can be helpful around working on your impulse control, right? That person that just blurt things out and is kind of offensive to other people, it makes for difficult friendships and relationships. So, sometimes realizing the impact of your behavior on the people around you can be therapeutic as well.
Yeah. And there are things that maybe perhaps, like you said, that you may think you have ADHD because you have some of the symptoms, but there's crossover because a lot of women struggle with anxiety. That anxiety could be ADHD from not being able to manage all these things, or it might just be anxiety, right? So you really need someone
Right.
who can tease it out.
Right. So anxiety, can manifest as inattention and kind of some of that motoric restlessness and inability to focus because you've got so many racing thoughts, so many different things going on in your head, and you're worried about this and this and this. Right. So that's why, like, that core piece of, can we trace these symptoms, back to before age 12? Because if it's just been happening more in the last 6 months or a year, it likely is anxiety related or depression related, because in depression, depression and anxiety are very often overlapping. So that's why I think getting a more clear diagnosis and ruling out things that may in fact be inhibiting you in your daily functioning.
So I guess bottom line is there isn't a one size fits all approach. Some people are going to need or want meds, some are not. There's all different kinds of strategies, but the knowledge is power. So if you are an adult, knowing that this is a disease or a disorder, I don't even like calling it a disease, but it's a difference in your brain that you might want to make sure you learn everything about, because knowledge is power, right, Doc?
Absolutely. And then, it starts with identifying, it starts with reading, it starts with talking to people. So doing some of those low level things, getting feedback from your loved ones around you, like, do you think this might, be true for me?
Yeah.
And if it is hindering your functioning, if you've gone through 3 jobs in the past 2 years and you just can't seem to stick with things, and you're realizing, oh, you know what, I'm actually being hindered by this, then taking those next bigger steps around either medication evaluation or more active treatment.
We're out of time for now, but thank you, Dr. Laura Saunders. And for everyone watching, have a great day and be well.
CURES is sponsored by Wheeler Health's Better Choice program. More at wheelerhealth.org.